Good evening to everybody. Thank you so much for being here. I'm Dr. Israel Carmona, and I will start with the presentation. Institut Marquès is a clinic that has been running for more than 90 years. But we are here in Ireland since 2 years ago, and we are trying to improve and to offer the same standards that we offer in Spain, and to give you the best care in reproduction. I will start with things like what we need to get pregnant, how to get pregnant. In this, we're going to start as how natural pregnancy occurs, what is the assessment to an infertile couple, the diagnostic, what are the requirements for any treatment or any approach to the couples or to the persons, and all the treatments that we can have. After my speech, the lab will be with you and they will discuss further information to you. And we are going to have a brief moment for questions and answers to us, consultants, Dr. Shamoun, myself, and the lab team. After this, we can organize so you can meet the clinic in a couple of groups, and that'll be all. If that is okay with you. Let's start. Natural pregnancy. How natural pregnancy occurs. As you know, every month the woman ovulates, a follicle starts growing, and that follicle contains an egg. That egg at mid-cycle ovulates and is ready to be fertilized. But the egg can be fertilized only for 24 hours. So the sperm must travel from the vagina all the way through the cervix and the uterus and to the distal point here in the tubes. Here is when it's going to fertilize that egg. The difference between the egg and the sperm is that the sperm can survive there for around 3 days. So that is why it doesn't need to have intercourse that day of ovulation. When fertilization occurs, the egg must travel, the egg fertilized must travel, go back to the uterus to implant, and it will develop into a blastocyst. As you can see, it becomes first a zygote, 2 cells embryo. This is the cleavage stage, 4 cells, 8 cells, morula, and blastocyst. And blastocyst is the stage where the embryo implants. So it's around 5 to 6 days, and then it becomes a pregnancy. As you can see, there will be a lot of things that can happen and that can impair fertility. Fertility is not an easy issue. As you can see, if we take 100 couples who are 25 years old, both, and they are healthy, they have previous children, and we put them to have intercourse that day of the ovulation, how many couples do you think are going to get pregnant? Just guess. Just 25%. So those are the chances on natural conception. Those are the chances per month. That's what I want you to get clear. The problem is that these 100 couples, in a lapse of around a year, around 95% of them are going to get pregnant if they are completely healthy. Okay? Fertility occurs 1 in over 6 couples. My chances of pregnancy by woman's age. My chances of pregnancy are declining because of the eggs. I know it's very difficult to say this, but this is the difference between a man and a woman. The man produces new sperms every day, but the woman don't. The woman just released the eggs which she was born with. So that is the problem for this. This is a fertility issue. A fertility emergency. Around 35 years old, as you can see here in the graphic, our chances start declining too quickly. So that is why we must act fast. If we reach our 40 years old cutoff point, then we have a problem. That is why we usually try to act before. Okay? What is infertility? Infertility is defined as one complete year of unwanted non-conception with unprotected intercourse in the fertile phase of menstrual cycles. I told you, 1 out of 6 couples present infertility. So how can we assess that couple, or how can we assess fertility? Because it's not only the couple. As I always tell the patients, in order to get pregnant, we need 3 things, just 3 things: an egg, a sperm, and put them together. So if these are the things that we need to get a baby, then we need to assess each of these. So we are going to start with the egg. What do we need to assess the egg? There are 2 things that are the most important of them all. First, a blood test. I need to see how the hormones are. Second, a scan. I need to correlate those findings of my hormones produced here in the ovaries with how many follicles do I see in a scan. This number of follicles and the blood test is going to help me to assess the ovarian reserve and the chances of pregnancy of that woman in a future time. So what else do I need? Remember, the sperm. The sperm is the second thing that I need. How can I assess the sperm? Simple, the semen analysis. And what do I need? What do I need from the semen analysis? Basically, 3 things are the most important things of all. The first one, how many sperms do I have? Of course, I need to have a lot of sperms, millions of sperms. The motility, how good the motility is, how they are moving, if they are moving progressively. Morphology, if they are normal in shape, the shape of the sperm. Because I can have tons of sperms, but what happens if I have 2 heads in sperm, 2 tails, a globus sperm that is like a balloon? So these are the things that I need to look forward in a semen analysis. Next thing, put them together. Remember, the 3 things. This is the third one. Put them together. Are the tubes clear? That's another test that I need to do to assess if the tubes are clear and the uterine cavity. This is usually done through different tests. The most common here is Hycosi test, which is to put some contrast medium here and do a scan and then see if that contrast medium goes from all the way from the uterus to the pelvis. So even if I'm telling you, oh yes, that the tubes are clear, that doesn't mean that these tubes are functional, but at least they are clear. I'm going to explain that later. Diagnostic. So as you can see, remember this first slide. This is natural conception. So what can be wrong? What can be wrong here? For example, I can have abnormal sperm or no sperm at all. I can have abnormal eggs, bad quality eggs, poor eggs affected by endometriosis, things like that. I can have abnormal tubes that they are blocked or that they are clear but they are not functional. Because if they are not functional, they will not permit the pass of the baby. And for example, an ectopic pregnancy can occur here. Abnormal receptivity. If I have something here, for example, a fibroid, polyp, something that is impeding the embryo to implant. What else? Abnormal embryos. What happens if the embryos are not good? If chromosomically or genetically they are not good, they will not implant. So as you can see, the diagnostic is very simple. First, I need to identify abnormal factors, treat what I found that is wrong or that is abnormal, and select my best approach to that person. All this is done always modifying my lifestyle. What does include this? Exercise, no smoking, no alcohol, or well, reduce alcohol. And in practical terms, I need to be healthier. If I want to have a healthy pregnancy and a healthy baby, I need to have a healthy mom. So what are my requirements? What do I need for a treatment? I can tell you that requirements are divided between those that are by law and those that are our own policy. Why? Because we are the responsible ones to give you our success rates, our chances of success. So that is why we need some things specifically. As I can tell you, requirements by law, I need to have a recent cervical smear. I think here is around 3 years valid, so I just need that. Every treatment needs to have a viral screening, which it means to be screened for HIV, syphilis, hepatitis B, C, etc. Of course, I need to know the blood group of every one of you. Sign consents, and when we are going to enter in a donation protocol that can be eggs, sperm, embryos, I need to have counseling. This is by law, requirements by law. Our own policy. Of course, if the doctor or the consultant is assessing you and is saying, I need to assess your ovarian reserve, I need to see if the tubes are good or not, and I need to see the semen analysis, but the semen analysis must be done in our clinic. Why? Because we have found surprises when we are in the middle of a treatment and we are based on another semen analysis in another clinic, and then it doesn't correlate. So that is why we implemented this as a policy. This is needed here. The rest of the tests, probably we can work with them. The specific tests, if the doctor requires this means that it's something that is going to improve your chances of pregnancy, or that we need more information to proceed and to select the treatment. For example, there are couples that have recurrent pregnancy loss, that have 3, 4, 5 miscarriages. So we need specific tests for those, genetic tests or others. The doctor will decide which ones. At the end, treatments. What options do I have for treatment? Well, a lot. It can be since hormones, pills, injections, surgery, just a follow-up, timed intercourse, IUI, IVF, PGD. As you can see, there are tons of treatments, but which one is the best for you? This is a small table just to show you what I told you at the beginning about the chances of pregnancy per month and how this cumulative pregnancy rate goes. So as you can see, in over a year, almost all the people who is completely fertile is going to get pregnant. But what happens in this subgroup of women who are less than 35 years old? If they continue to natural cycles, they are not going to get pregnant. This is the help with ovarian stimulation plus IUI. This gives us like from 12 to 20% of chances of success per treatment, but it's a cumulative rate. And it stabilizes after 3 or 4 attempts, and it goes flat. It doesn't increase more. But IVF, sometimes we require IVF, and IVF will go higher. And as you can see, 3 or 4 treatments will give us the best success rates. For example, what happens if I have good eggs? What are my options of treatments? As you can see, my options will be timed intercourse, intrauterine insemination, or IVF. If I have good eggs, I have all the options. I'm going to explain this in a brief way, and this example will be with IVF, ovarian stimulation for IVF. For example, as you can see, the first day of your cycle, you need to inform us, and then we are going to start the injections. The injections are done, or the drugs are given for a space of around 10 days. Between those 10 days, we need to do scans because we need to control, to monitor those follicles. And as you can see, here is an ovary. And look how the ovary has grown. This is the same woman, the same ovary, and the same cycle, just different days. And as you can see, it goes from practically, you cannot see nothing here, and how big the follicles are here. So once we know that we are ready to go, we schedule the egg collection, the retrieval of those eggs. We also have the option for timed intercourse. We have the option for IUI, or we have the option for IVF. So how the IVF procedure is done. As you can see, this is a scan, but look at this. This is a needle. And what is the purpose of this is just collect all the eggs so we can fertilize them in the lab. There are two different ways of fertilizing an egg. Conventional IVF, which will be just to put all the eggs in a petri dish and put the sperms around them and wait until the next day. But there is also ICSI, which it is to select the best sperm, take it, grab it, and inject it directly into the egg. ICSI was created for male factor, when the sperm is not good, when the sperm is not moving, or we have just a few sperms. What is next? Do you remember the first slide, how the embryo goes through different stages of development? Well, the same thing happens here in the lab, but this time they are monitored in an Embryo Scope, in an incubator, and we are assessing how the quality of those embryos is going on. And once they are ready, we put them back into the uterus on day 5, which is the best day, because it gives us the best success rates. And just with a catheter, like a smear test, and we put a catheter here, and we put the embryo back. What happens next? Simple. We wait 2 weeks for a pregnancy test. If it's positive, we wait 2 more weeks, and we search for the baby, for the embryo. An IVF procedure, usually, the purpose of it is to produce a lot of eggs. But what happens, for example, if I have a lot of embryos and I freeze them, because I'm not going to put 3 or 4 babies at the same time, and I have them there frozen. Also, what other procedures can I have? What happens, for example, if the eggs are not good? I need egg donation. I need eggs from another woman to fulfill the dream of getting the pregnancy. Or what happens if I need embryos? Because neither the sperm or the eggs are good. So all these treatments can be done through endometrial preparation. This is another example of treatments that we need to do. For endometrial stimulation, it's going to be different. As you remember, we were giving drugs or hormones to produce a lot of follicles. But this time, if I already have the embryo, or I'm going to use another eggs, what I'm going to do here is just to prepare the uterus so it can receive the baby. And it's very simple. I usually just need to take a pill or a patch, to put up patches, like for the same space of time, 10 days. And then we give some other hormones, pessaries, and we prepare the endometrium to receive the baby. What other supplementary techniques can we offer? What other things do we have? In order to improve our chances of success, sometimes we need to go further. How? For example, IMSI. IMSI is another technique to select the best sperm for use in ICSI. It's something that the lab can explain better than me. We also have Polaroid. That is a special light that helps us to see where to inject that sperm into the egg. Embryo Scope. This is an incubator that has a camera built inside and is recording 24/7, so I can see the embryo 24/7. And also, because it's recording, it produces a video so I can see how the embryo was developing. So this helps me to select the best embryo for implantation. Because of the Embryo Scope, we have developed an app. And through this app, you are able to see those things at the same time as we do. This is a way to show you our transparency and how confident we are in our results and in our lab. And last, music for the embryos. Institut Marquès has been creating a lot of studies or research regarding music. Why? Because it's not like the baby or the embryo is going to hear the music or listen to the music, but it's because the music produces some vibrations and helps the embryo to get rid of the waste products when the development occurs. If a woman gets pregnant, she continues her normal life. She never stops moving. And in the lab, they are static. This is how we started with these projects and this research. And it has shown that the music can help to increase the chances to 5 or 10% more than usual. Donation programs. We have a huge donation program for eggs, sperms, and embryo. In this moment in Ireland, it is permissible to have anonymous and known donors. But probably in a future time, Anonymous will be banned here. But this will depend on the law, on the Irish law. Our donation programs are very well established since years ago, and we have the best results that you can imagine because all our donors or our egg donation program is in fresh eggs. That's what makes the difference. Some other clinics or some other programs includes egg donation through frozen eggs. But we have found that the best success rates are with fresh eggs. That is why we established a program that it only takes 6 weeks and we can have an embryo from a fresh egg. All our donors are tested for genetic screening, genetic disease, a karyotype, cystic fibrosis. Cystic fibrosis is very common in Northern Europe, so that is why we tested. Blood group, viral screening, of course, and psychological tests. All our donors for egg and sperm needs to be tested by this. And they are assigned to the recipient through race, blood group, physical traits, and we have a special software for photo matching. This is our goal, to have a baby in our arms. Not just a positive pregnancy test, but that you can have a baby in your arms. So now, the lab will continue with the presentation. At the end, remember, we are going to have some time to answer questions.
Okay, good evening, everybody. My name is Esther Aroca. I'm one of the embryologists of Institut Marquès Klein. First of all, thanks all of you for coming today. I will try to do a brief presentation of what we do in the lab. Well, first of all, which is our mission? As Dr. Carmona said, we do all our best to get a baby for all our patients, and then make their dreams of parenthood come true. As you know, this is a long procedure, this is a long treatment, and after doing all the scans, monitoring, we can choose the best treatment for every couple. That's why we want to treat every couple singularly, because one treatment for one couple, it may not be the best for another one. That's why we want to treat you personally. Our lab is daily working not only to get the best equipment, also to try to get validation and a license for new procedures that our patients need. And we are not currently doing here in Klein, but yes in Barcelona, but to make the treatment easier for our patients. All our procedures are managed by the HPRA, are controlled by the HPRA, which is the strictest authority here, who give us the license to perform all of these procedures. Well, the patient pathway, as Dr. Carmona said, first of all, is the first consultation to review the medical history, to make all the scans, all the tests and everything. And after that, we can choose the best treatment for each couple. I'm going to explain now these procedures with a little bit more detail. The first procedure I can talk about is the intrauterine insemination. As Dr. Carmona said, they make a little stimulation, and they follow the growth of this follicle. And then at the time of the follicle is about to ovulate, we receive the sample in the lab, and what we do with this sample is to clean them. We try to discard all the immotile sperm and select and concentrate through a column of gradients the better swimmers, the best motile sperm for this intrauterine insemination. And then at the time that it's expected the ovulation, we inseminate. The next treatments to talk about are IVF and ICSI, the intracytoplasmatic sperm injection. Both treatments require to collect the eggs previous the fertilization time. In this case, what we receive we receive the follicular fluid from the theater after the procedure Dr. Carmona explained, and we search all the eggs in this fluid. We search and collect all the eggs, and we keep them in culture. The main difference between these two procedures are the way that the sperm fertilize the egg. The in vitro fertilization, we keep all the eggs together, and then we put a drop of sperm previously prepared as the intrauterine insemination, and then we let them overnight, and then the sperm has to swim, reach the oocyte, and then fertilize. The main difference with the ICSI is that we have to strip these eggs. We have to denude the cumulus cells. And then when we have the eggs naked, we choose one sperm, the best that we can choose in that drop, and then inject it directly in the middle of the egg. And next day, we can check the fertilization. Also, another option that we have is the egg freezing for those women that decide to preserve their fertility and undergo these treatments later in a few years. What happens next in the lab? As Dr. Carmona explained, the way that the embryo has to do until it reaches the uterus, it's a long way. So we have to monitor these embryos during 5 days in culture in the lab. Why? We prefer to keep them during 5 days in culture. Because, as he said, the stage that it reaches the uterus is the blastocyst stage. So those embryos that reach blastocyst in culture are the potential embryos for implantation. So they are the ones that have better chances to implantate. That's why it's better to do the transfer at day 5 instead of day 2 or day 3. Always that the number of embryos, we have a good number of embryos to keep them in culture until day 5. Another thing is that the remaining embryos that we haven't transferred in that cycle, we can freeze them. And then we have another chance, in case during that treatment we haven't got the pregnancy. We have remaining embryos to do a frozen embryo transfer, or even if you want to have a second child in the future. Let's talk about the donors. Many of you maybe are wondering about these donor programs. I start with the egg donation program. This is our center in Barcelona. We have a huge egg donation program there. We have around 2,000 cycles per year, and most of them are under the egg donation program. All the donors are anonymous, because in Spain, all the donors must be anonymous. And what we can do here, in case that the couple needs an egg donor, and the sperm sample is okay, it is good enough to be frozen, we can freeze the sample here, send it to Barcelona, then they fertilize the fresh eggs, and they send us the embryos already done. So we do the transfer here. So the couple hasn't have to travel to Barcelona for anything. That's the thing to make easier for the couples undergoing through these treatments. About sperm donation, one of the biggest companies that we work with known donors, it's European Sperm Bank, in case you require a known donor. Or in another case, we use Biosperm. This is the Institut Marquès bank sperm, sperm bank. This is our own sperm bank in Barcelona. So if you require an anonymous donor, we can choose one of here. All of them, eggs or sperm donors, are selected through the physical traits of the couple. So we try to match them as much as possible with the couple. And the last program I want to talk about is the embryo donation program. At this time, we have get more than 1,000 babies born with this program. These embryos are from couples that they have had already their treatments, they have their childs, and they have these embryos frozen, and they doesn't want them anymore, so they donate those embryos to other couples that doesn't have that luck yet. So we have had more than 1,000 babies in the moment. This is the baby number 1000, born with this program. This is our team in Barcelona. It was a really celebration time. Additional techniques. PGD. Maybe some of you have heard about this. This is a technique required or recommended to those people that have hereditary diseases in their families or those couples that are around their 40s. This consists in take one cell in case the biopsy is done at day 3 from the embryo, or a few cells from the trophectoderm in case the biopsy is done at day 5. As I said before, it is better to keep in culture the embryos 5 days, not only to select the best embryo, because we are giving them the grades, the scores, and we can pick up the best embryo. Because in this case, we can differentiate 2 important structures here. This is the inner cell mass, which will form the future baby. And these other cells are the trophectoderm that will form the umbilical cord, the placenta, and all of these structures. That's why to do a biopsy at day 5 and take these cells, it is better than doing at day 3, because we don't know which of these cells will form the inner cell mass. So it is less damage to the embryo, we could say. Although we will not have a fresh transfer in this situation, it is, at least biologists prefer to take cells from the trophectoderm than to do a PGD at day 3. Another equipment we have in the lab, this procedure, this technique, it is not performed yet here in Klein. We do that in Barcelona, but hopefully we can start doing this year. So for you to be easier to come here and not to go to Barcelona. The other technique we do, well, the other equipment we have is the Embryo Scope. This is an incubator that uses the time-lapse technology, which means that they make, this incubator make a picture every 10-15 minutes while the embryos are in the incubator. So we don't have to take the the embryos from the incubator. They can stay there during the 5 days, and they don't have to go out for anything, as a difference to the older incubators. And moreover, another advantage for you as a patient is that we can make the video, and you can watch the embryos during these 5 days, how they are growing and developing. Another systems we have in the lab, one of them is the RI witnessing system. This is, well, all our samples, all our dishes are tagged by a barcode. So in case we have 2 different patients in the same hood, this system will alarm. So it is impossible to cross any sample in the lab. This is our safety system. Another thing is the cryo storage room. The cryo storage room is where we keep all the frozen embryos, the frozen sperm, and also the frozen eggs that patients came here to preserve their fertility. And we work in a clean room environment. What does mean? Every time we go into the lab, we have to change our clothes. We have to put a hat, put new shoes, everything. And also what we have is a positive airflow, that it means that the air can't come in, just can't go out. So the dirty, the dust can't come into the lab. Also we have good filters that avoid the dust and the dirty that can come in. So it is a clean environment. So thank you, all of you, for listening to me. If you have any question, you can ask after.
Okay, so I'll be really brief. I just want to talk a little bit more about the company. So Institut Marquès, it's one of the most international and reference companies in the field of assisted reproduction and obstetrics, and also in gynecology. Sorry. Okay. This is one of the most important, and we are around 200 people working there, like as a team. because we are based in Barcelona, but we have other clinics also in Italy, in Ireland here, and in London. So for us, the most important thing are like the excellence, the innovation, safety, and transparency. Why excellent? Because we offer the patients more than they expected. We like to treat them or like in a cozy environment. This is the most important thing for us. And also to personalize all the attention and all the therapies that we are doing. So we also have, which is for us one of the most important things, a medical team that is really experienced in the field of assisted reproduction. The innovation for us is also really important. We are always doing investigation, and because, for example, we think that it's really important to improve our rates. We have 89% of succession rates in our donation program, the egg donation program, which is a really good rate. And we also try to improve those rates with the music, as they have explained earlier. We put the music inside the incubators while the embryos are inside. So the vibrations allows the embryos to take all the bad, the particles outside and to regenerate more all the nutrients. So we have seen that we have improved like 5–10% of our succession rates since we're doing that. And we also had a concert. Well, we have some concerts. 2 months ago, we had Sharon course in Barcelona in the lab. And we watched the live concert in streaming here in Ireland. The safety, of course, it's really important. Esther has explained you about the RI witness system to not mix samples or whatever. And we always try to improve that because it's the most important thing. And transparency, why? Because we are the only center that allows you to watch the embryos while you have them in the incubator. So the first day, we send you an email and you can log out with all your email, and then you can see your embryos by in your phone. So you can follow the embryos step by step, and this is completely transparent. So why Institut Marquès? Well, we have a video, yes? Because we have our director, Marisa López Tejón, can explain you better all the things that we have explained to you. Have we got it?
Well, this is our presentation. I just want to point out again that our purpose is for you to go home with a baby in your arms. We are evolving, we are changing, and we are improving to give you the best success rates and also the best fertility care here in Ireland. Now, if you have any questions, please feel free to do them. Do you have any questions, or prefer to have questions in groups? I think, yeah.
How long does the procedure from downregulation to embryo transfer take, roughly?
The procedure from what, I'm sorry?
From downregulation.
From downregulation.
Yeah, through to stimulation, egg collection, embryo transfer. Roughly, how long does it take? I know it will obviously depend from person to person, but roughly, how long?
You want to participate?
It depends on the protocol you are using. The regulation is a long protocol. It takes about 4 weeks from starting the spray to put the embryo back.
Yeah.
And then you wait for 2 weeks for the result, the pregnancy test. The short protocol normally start day 2 of your cycle, and embryo transfer again could be day 19. So it's about 17, 18 days.
More questions? Difficult ones. Okay, yeah. That's a good question, because the answer for this is we need to look at an egg and the sperm as single cells. The egg is just one cell, and the sperm is just one cell. The problem with that is that the vitrification process, even though vitrification is the best thing that could happen for frozen techniques, for freezing techniques, it is still a harm to that cell. So it's different from freezing an egg to freezing millions of sperms, and also to freeze an embryo, because an embryo, we only freeze embryos on day 5 of development, blastocyst. And that blastocyst has over 200 cells. So it's not that affected by the freezing process as the egg. That is why we have the best success rates, because even if we freeze the embryo and the embryo is traveling, it's not Ryanair, it's traveling from Barcelona to here to Klein, that embryo has over 200 cells that can resist the process. And thanks to that, we can offer the same success rates as on a fresh cycle. It's not the same as for an egg.
That's great. Thank you so much.
Yeah.
My question is for the as well, or embryo adoption, and the difference between
Embryo donation and embryo adoption. Embryo donation is when a couple has fulfilled a couple or a person has fulfilled their desire of family, they have the family that they wanted, they can opt for the option of donating those embryos. Embryo adoption is embryos that are abandoned. The problem with those embryos is that we have found that they are abandoned 2 times, by their parents or their parent, and by the clinic themselves. So in every clinic in the world, embryos are accumulating. So we started this program since 2004, because by Spanish law, if the owners of that embryo is not contacting the clinic or is refusing to make a decision on the destiny of that embryo, it is property of the clinic, and it's an embryo abandoned. So that is embryo adoption, to adopt those embryos that are abandoned. Of course, this will make you have more questions. For example, how good those embryos are. Because of law, and because we want to offer always the best success rates, but it's not only success rates, it's also a healthy baby. Those embryos need to be under donor regulation rules. For example, we cannot accept embryos for our embryo donation program or an embryo adoption program who are from eggs that are from a woman over 35 years old, or a sperm who the man is over 40 years old, or that they have a genetic abnormality or something. We cannot accept those embryos. So these embryos are good embryos.
Are they starting to?
Yeah.
But is it an anonymous donation in terms of, say, a child in the future who wants to?
It is an anonymous donation.
Always anonymous.
Always anonymous.
Donation and adoption.
Yeah. Unless the embryo donation is becoming from embryos here. Okay. Our embryo adoption program is in Spain, so that's completely anonymous.
Is the Embryo Scope available for just ICSI or regular IVF as well?
The lab can answer.
Is the Embryo Scope available for just ICSI?
For both techniques, yes.
In IVF, we put the embryos on day 1 because they have to stay in another incubator during the night with all the sperm. And the next day, we remove the cells from around the eggs and we put in the Embryo Scope. So you can check from the day 1, but it's the same thing.
You wanted to ask something? I'm sorry, I cannot.
Sorry, so say if you wanted to be the person to give your egg to somebody else, is that done in Ireland or would you have to go to Spain?
If you want to donate,
Yeah.
yeah, we don't. We currently are not offering any donation here. Our known donors, our known donor program, is through a bank. That needs to be through a bank.
If you require a license, you have to apply for a license from SBRA. And it's not forbidden, but the clinic has to apply for the license. And if we get approval, then yes, it can be done. And it is done before, so it is possible.
Well, we're gonna end the presentation, and of course, we're gonna stay here. If you want to ask some questions, feel free to do it. Okay? And you are going to go in groups, so to meet the clinic with our amazing lab team. Perfect. Thank you so much for being here.